Okay, good afternoon, ladies and gentlemen. We might as well get started. Welcome to the first World Congress on PPPM in Bonn, Germany. I distinctly remember that it was about 12 years ago around this time that I was in Germany, in this city, in this room, and we had our International Congress on Acid Research. And I also distinctly remember that when the University Rector at the time opened the conference, that time actually kind of coincided with the move of the capital of Germany from Bonn to Berlin. And Richter made a comment that with that move he would love for Bonn to become the scientific capital of Germany. And in fact, this has apparently materialized, and that's why we are here. So it's really a distinct honor to be here today before you for our session on preventive, predictive, and personalized medicine in diabetes care. I would like to introduce my co-chair, Professor Josifova. I'm also going to be joined by Professor Salminen, who will be the moderator for our panel discussion, and also Professor Coelho, who will be presenting the abstracts that he has selected for this meeting. All of us are very familiar with the increasing prevalence of diabetes. This is an excellent article from our first volume of the EPMA Journal by George and colleagues. As you can see, the upward trajectory apparently is holding up steadily, and the numbers are believed to continue until 2035 and beyond. And the prevalence of the disease, of course, is similar for women and men. So both gender are really afflicted with the disease. This slide takes you through the time course of changes that have occurred in prevalence in the United States. And as you go through this slide, you will know that the colors change from the blue, the better colors, to reduce prevalence, to more red, which indicates greater prevalence. And because you probably missed the first one, we're going to go through it one last time.
Oh, it was so nice to see California in blue. We've got lots of McDonald's in California, you know.
Exactly.
So why are we blue and Texas black?
Wait, you want to change?
It's coming up. There you go. Well, we'll show up. California will catch up. They're behind you usually than the rest of the country. Okay.
So why are we behind?
I'm sorry. You're not behind, California. Okay, so as you can see, the numbers continue to increase. More and more states are becoming red as time goes on. And of course, it's important to recognize that the greater prevalence of obesity and overweight, type 2 diabetes that at one time used to be thought to occur mainly in individuals who are 40 years and beyond is no longer occurring in just that population. As you can see on the left panel, teenagers are pretty much afflicted with this disorder, and this slide also breaks it down in terms of the prevalence among various ethnic groups, with Indian Americans, of course, being worse off. So, the question is what is contributing to it? Perhaps it has something to do with what we eat and the way we exercise in the United States, and particularly in the southern states, Georgia included, because I'm from there. But of course, all good things in life, there usually is consequences to be paid. And the consequences of that include major organ systems being affected with pathology, and the 5 major systems are very well known to everyone. But on this slide, I have also included pathologies involving the oral cavity, and today we have an excellent presentation by a periodontist on this issue, which I will try to elaborate a little bit more on it because I think we have to bring dentistry in this picture, and I will give you my reasons why I think we should do that, and hopefully Professor Golubnitschaja will still let me talk after today. Right, Dr. Golubnitschaja? Okay, recognizing this very important problem, a number of visionary individuals have been at the forefront of saying that we really have to have a paradigm shift in terms of the way we approach management and treatment of patients with diabetes or other diseases. At the forefront of them, of course, have been Professor Costigliola and Professor Golubnitschaja. They have worked very hard behind the scene. They have tried to really involve major organizations in this great cause of PPPM, which we have heard a great deal the last few days. And as exemplified on this slide, you will see that the United Nations is already on board. And the fact that there are representatives from 43 different countries already after the first couple of years of inception of EPMA speaks really volumes in terms of the work that has gone behind the scene quietly to get us to where we are today. As one of the first initiatives with respect to EPMA, the EPMA Journal was established, and the idea is excellent because of the rapid growth in knowledge in various fields. The idea was to go ahead and provide individuals who are interested from any discipline with respect to diabetes or other diseases with excellent review articles in order to keep them, in order to help them keep pace with the rapid growth of knowledge. I was honored when Dr. Golubnitschaja asked me to be the guest editor for the first volume, which was on diabetes care, and now we are into the 5th volume. The 6th one should be coming out shortly. This really gives me a chance to also express my sincere appreciation to all the authors who really made the first volume happen in a relatively short period of time. Some of them are here, and I really want to thank you for that excellent job that you all did. As part of the program today, the editorial board of the journal has selected a number of excellent articles, and these will be our keynote speakers today. So we will start with our keynote presentations. That would be followed by other shorter oral presentations. And I would request that you would please hold on to your questions until Professor Salminen moderates our panel discussion. And at that point, I hope we have a very lively and great discussion of all the presentations that you will see today. We will conclude our session with Dr. Coelho's presentation of the best posters for the diabetes session. Now, I want to warn you that Dr. Josifova has brought her Swiss watch from Switzerland, and she's going to be keeping track of her time. But because we are missing actually the first presenter for this session, unfortunately Professor Sena could not be with us today. So she's going to be a little bit lenient with respect to the time, but we want to really stay on time as much as possible. Now, I could not possibly end this introduction to the session without thanking two individuals. And as you can see, they have beautiful smiles and they work very hard, really behind the scenes, again, to make this session possible. So if I would like to applaud them for what they have done. They are standing at the back of the room. They both have to use their first name, Christina and Melanie. So thank you very much for all your hard work. Now, I'm coming from Georgia Health Sciences University, which is located in Augusta, Georgia. How many of you play golf? One person, very good. So you must be the rich one among us. Nice to have you here. Now, Augusta, aside from being the home of Georgia Health Sciences University, is also the place that master tournaments every year are held. That's when we get basically all the rich folks, all the great golf players coming to town the first full week of April, and it's such an exciting time that even our little friends want to play golf with us. Okay, well, I want to thank you for your attention, and we're going to start our session.